Thank you so much for allowing me to join you today at this conference, and thank you for all that everyone has been doing to further the use of medical CBD oil in the Commonwealth of Virginia. I've enjoyed working alongside of so many of you to further that access to Virginians. Going back to 2017, when we all worked together to try to allow for its use beyond just that for the treatment of epilepsy. And in 2018, together, we made it happen and allowed processors to come into existence in Virginia to help with the availability of treatments. 2020, we had a bill that became a study that hopefully next year will allow us to further the use of the products necessary to help those in need in the Commonwealth. Hopefully we allow for the use of buds and vaporizers and help assist our veterans suffering from PTSD. I'm excited to continue working alongside you going into the 2021 session, and together I think we can make further progress to make sure that all Virginians have access to the treatments that are necessary to make sure that they have the best quality of life possible, regardless of their affliction. Today, I have the honor of introducing the panel that will be joining us momentarily. First, moderating the panel is Herb Jones. Herb is the CEO of Pyramid Technologies. It's a cloud computing and project management consulting firm. He's a retired U.S. Army combat veteran serving tours in Afghanistan and Iraq, and was the treasurer of New Kent County from 2000 to 2011. He currently serves on the board of directors of Normal, the Roanoke Area Ministries, and Achieving Community Excellence in Williamsburg. He's also a charter member of the New Kent Rotary Club, and in November of 19, he was a Democratic candidate for the 3rd Senate District in the Commonwealth of Virginia. Additionally, one of my colleagues is joining us, Delegate Dawn Adams. Dawn is a certified adult nurse practitioner and a member of the House of Delegates representing the 68th District. She earned her doctorate of nursing from Old Dominion University in 2013. She got her BSN in 1986 from James Madison University, her MSN in 1989 from the University of Virginia, and a postgraduate certification as an A&P in 1999 from VCU. She's got nearly 35 years of clinical experience in a numerous number of settings. As a legislator, her committees include health, welfare, and institutions, where she's also the chair of health professions. She was recently appointed to the Joint Commission on Healthcare, the Disability Commission, the Committee on Coal and Energy, and the Joint Subcommittee on Block Grants. Additionally with us is Tamara Netzel. She's been a Virginia medical cannabis patient since 2018. She was initially diagnosed with multiple sclerosis at the age of 42 and had accumulated a long list of medications prescribed to her to manage her MS symptoms until those medications caused her liver to go into failure and ended her 16-year career as a teacher. She since has replaced those medications with cannabis starting 2 years ago, and since has dedicated herself to continuing the education for others and advocating for medical cannabis patients, serving on the Virginia Normal Board of Directors, and founding a 501c3 to help fight for cannabis social justice issues. And she also created the Virginia Medical Cannabis Patients Facebook group to help patients navigate the new cannabis program in the Commonwealth. She was also featured on numerous media outlets, including NBC Dateline. Additionally, Lisa Smith is with us. Lisa grew up in Northern Virginia, and she left the D.C. area for a quieter, less political lifestyle in the Northern Neck. And she's mostly known for being Haley's mom. Haley was born with a disability. She was born with Dravet syndrome, and that's a syndrome that is very rare and catastrophic. It's a lifelong form of epilepsy that begins in the first year of life with frequent and prolonged seizures and a number of other issues. Her first seizure was at 5 months old and lasted for over 25 minutes. After traditional medications failed, she worked hard to find other solutions and other treatments for her daughter. In 2015, Lisa, along with a group of parents, lobbied the Virginia General Assembly, looking for the use of medical CBD oil and THCA oils for patients with epilepsy, and had unprecedented success. After that bill passed, she's since put herself and helped others across the United States to help continue efforts to make sure other patients have access to such treatments. Lisa's journey was first highlighted on Dateline NBC special Growing Hope, which aired in June of 2015. A follow-up of that story aired in May of 2018. Since then, Lisa and Haley have returned to help further legislation associated with medical cannabis. In October 2020, Lisa and Haley were able to realize their hard work when Haley was the first official patient of Dharma Pharmaceuticals in Bristol, Virginia. Next on our panel, we have Franza Kennedy. She's a founding principal, owner, president, and pharmacist in charge of Delitso LLC, one of Virginia's 5 medical cannabis pharmaceutical processors. She's president of the Virginia Medical Cannabis Coalition, which is the medical cannabis industry trade association comprised of all 5 medical cannabis pharmaceutical processors. She's a member of the Virginia Pharmacists Association and serves as the chair for its Academy for Medical Cannabis. She's also currently a member of the Virginia, Northern Virginia Regional Human Rights Commission and a fellow at the American College for Apothecaries. And she's a member of the Professional Compounding Centers of America. She's also the owner of Alexandria Compounding Pharmacy in Fairfax. Thank you so much again for allowing me to join you today. I really appreciate the opportunity. And now I'd like to turn the panel over to our moderator, Herb Jones.
Okay, thank you, Ben. The second question is for Delegate Adams, and from a provider angle, how quickly can we dismantle the stigma around cannabis to ensure patients have access to all treatment options that may provide relief for their illness?
Well, can you hear me?
Perfectly.
Excellent. Thank you, Herb. I appreciate the question, and thank you so much for Virginia Normal and TomTom for putting on this event. I'm certainly excited to be here. I could literally talk about medical cannabis all day long. To your question, I don't know how quickly we can do this, but I think it's incumbent upon us as I would say incumbent upon all patients as well as medical providers who are in the cannabis space to start talking about it more, start talking about it as medicine, and talking about how much of the information that we got when we were growing up was just false and based in, sort of, I think, a misunderstood policy initiative that most of us didn't pay much attention to when we were growing up because we were busy watching commercials about our brain on drugs looking like a fried egg. And so we've been really, we had no medical education on cannabis in school, and neither medical programs or I'm a nurse practitioner. It just wasn't part of the conversation, and it wasn't part of a, even a solution or a potential alternative solution to our healthcare needs. I think, for me, I have always, as a member of the General Assembly, voiced my opinion that, we have criminalized pain. And, while I really feel for the people who have had dependency issues, I really feel for people with pain issues and people with, conditions that have very little support or benefit now, and for which traditional medications don't exist or don't work for people or are so cost prohibitive that they're unable to access them. So I think as, patients and providers, start to talk about this more with other providers, certainly that will help. I have probably a different lens on much of the conversation because I am a medical provider, and I have been one since the time that when I started out as a nurse, we used to pass out Schlitz in a can to our alcoholics. So that's how old I am, is that used to be a care plan. So, I've really seen sort of many aspects of healthcare from both a clinical lens, a policy lens, an administrative lens. And so I think I really believe that the most important thing we do is to talk about it more, talk about its uses, talk about its efficacy, from a patient and provider standpoint. And then legislatively, we have to do better. And I could talk about that for an hour, but I won't. So I'll stop there.
Okay. All right. Well, thank you. Farzana, you've been able to open your doors and start operations. It's been a long road to get to this point. What were some of your surprising victories and some of the challenges that you faced along the way? Farzana, I think you're still muted.
Hey, I was unmuted. I quickly, I was muted. I unmuted. I think that is a that is a very lengthy answer if I were to answer all of it for the process that I have gone through and things that when we first started to the point where now what it took to get here, it has been a huge long road. And in that road, we had so many bumps and we continue to have them. And I think that we're getting better at resolving some of them at times. And other times we're just kind of keep going with the bumps and see when they'll get better. But to answer your questions, I think that that opening our doors, the victories are the patients. When I saw that first patient walk in that morning and sitting down with the patients, and Delegate Adams, you'll be happy to know I had many of your patients I have seen so far. So they say good things about that. So I'm like, awesome, so we connect here again. And I'm just like a clinician thinking about the patient's safety, education, and access as well. And I feel like that we struggle a lot with our education portion for the providers in the state to let them know and be part of this program that it's here. It's our responsibility to learn and grow with this program and be here for our patients and all these patients that I have seen in the last few days, they are patients. They have true characters of illnesses that they're coming with, and they heard my name. I've been in Northern Virginia for over 25 years, practicing as a pharmacist, as a compounder. So I've been very involved with a lot of my patients and a lot of the, critical conditions that I have dealt with patients. So they come in and they look for solution, and that's exactly what I'm dealing with. So those are my victories, that we're here. These patients are now can come into our state, stay in our state, and get the products and medications. So access is a huge issue, affordability, which is we're still looking to get there. We're not there. So I hope that next legislation and for the session that we can have that option for patients that are having hard time affording this product.
Okay, thank you. For all the attendees, if you have questions that you want to ask anybody on the panel, please put them in the chat, and I'll try to get to them before we end up at 12 noon. Tamara, let's go back to you. Can you talk a little bit about your road or your journey to becoming a patient?
Yes. So I became a patient back in 2018, and to treat my multiple sclerosis. Now, it's a little different as an adult patient, I think. There isn't that, it isn't treated the same with practitioners. I got a lot of pushback from even practitioners who are registered. But I'm very happy with the progress we've made and that we are here. And I could talk about myself, in my story. That's not exactly important here, except because I'd like to actually talk through, other patients. I run a Facebook group just for Virginia cannabis, the medical cannabis patients, and just having that community and being able to chat with other people in the same state who are medical cannabis patients, you can see that we have a long way to go. We have a long way to go. And I'm really glad that Farzana mentioned that, it is about patients. And I think we need to not forget that this program doesn't exist without patients.
Not answer that question.
And you know, it doesn't exist without patients. And if we're not taking care of patients, they're going to continue to do what they're doing now. They're getting their card in Virginia and going to another state and getting their medicine because it's, you know, it's not as costly.
Right. Right. Okay. A number of you participated in the work group to discuss the reforms to the medical program. One whole session was dedicated to the medical benefits of botanical cannabis. And both Senator Marsden and Delegate Davis expressed support for making botanical cannabis available to patients. Why is it so important to add botanical cannabis to the list of approved formats? Let's start with Delegate Adams.
Oh, thank you. I just believe it's fundamentally important that we have flower. So first of all, you know, I have many patients who have financial challenges, and I do think that it allows people to have a more affordable access. And then frankly, you know, we have a lot of literature and studies that have looked at the safety profile of smoking flower. And, you know, I think it's pretty apparent that if you're going to compare that to tobacco, it is you know, I would say less problematic. My concern, you know, is that we don't have that same kind of data if we're just allowing or only allowing people to utilize oil, you know, through an inhaled smoke, you know, situation, whether it's vaping or concentrates, what have you. I just think, you know, there has to be an option that is proven safe. It's less expensive. So therefore it's more accessible and affordable for people. People know how to use it and they don't have to really get any kind of special device or a more, even if you are vaping, you have to pay for the battery, you have to pay for the, you know, there's just a lot of supplies that go with it. You know, I think it's just more cost effective and I think user friendly in terms of, you know, people who have some challenges and, you know, would like to use flower in whatever way they choose. Certainly, it doesn't always have to be smoked.
Okay, thank you. Let's go to Lisa. Would you address that question? Lisa, you're still muted.
Mute. Thank you. When we started the whole process for my daughter, we were strictly looking for CBD oils for for the reasons that it was less benign in the legislators' eyes. And when the General Assembly passed that legislation, it was strictly looking at kids with epilepsy or patients with intractable epilepsy. Then in 2017, the group passed to let doctors decide, and Tamara was integral in that. But the General Assembly did not give a way for them to treat these other patients. So I think we need the botanical flowers so that we can address the needs of all the patients. I mean, we're fine with the CBD oil for ourselves, for my daughter, because she can't smoke something, but something that will treat epilepsy is not going to be there to help someone with pain or someone with MS or someone with cancer. So if Virginia is going to do the responsible thing and have a medical program that's comprehensive, they have to use the whole plant.
Okay. Thank you, Lisa. Let's Farzana, would you address that question?
Absolutely, and I think I totally, agree with all of the rest of the panelists here as well, that we need to have options for different reasons. It's definitely a treatment plan that needs to have different options. I'm dealing with it right now every day. See my patients, and I'm like, oh gosh, I wish I had the flower as an option for you, or I had another product that's an option for you, because remember that a lot of these patients are chronic and they're treating maintenance meds as well as breakthrough pain or whatnot. And flower having that pure form of all of the cannabinoids and all of the terpenes and just the entourage effect of it, some people just benefits better. And second, the accessibility, the affordability comes along. And when you have it in a medical program, when you have it in a controlled environment, it's the cleanest they're going to get. So I have patients right now that are receiving, products that they can from us or me, and then they still need flowers, so they're getting it from somewhere else, and that's something as safety is a concern as a clinician for me. I want them to have the clean product.
Okay, thank you. Tamara, to you again, the question is, why is it important to add botanical cannabis to the list of approved formats?
Because patients are all different. Patients are all different. And I think that plays into the stigma as well. I think we need to realize that there are a lot of patients who are 50 and plus, like me, chronic conditions. We're not talking about people that want to get high, and that stigma needs to go away. We need to drop that because, Virginia, and that plays into the cost as well, because patients want flower. They're going to continue to get flower, whether it's from Virginia's medical cannabis program or not.
Okay.
That's simple.
Okay. Now that medical cannabis sales have started, we've seen both excitement from patients and challenges. Fortunately, we're heading into 2021 General Assembly, and we'll have the opportunity to work on solutions that make this program more accessible and effective for patients all across Virginia. For each of you, what is your top issue or the top issues that you'd like to see addressed in the 2021 General Assembly? Let's start with Lisa.
Thank you, Herb. What I'd like to see that the dispensaries are not allowed to do right now is more education, for one, because I think that will help take the stigma away. They should be able to educate the patients and the community about what they're doing, and that this is medicine. It is not, what you think, just like what Tamara said. We're not all going out to get high. If we wanted to do that, we could still do that. We don't need a medical program. I'd like to see that. I'd also like to see more accessibility. For myself, I am in a rural area. For me to get to my dispensary, I have to cross 4 bridges just to get there, about 3-hour drive. We've gone down to Bristol already twice, and that's 8 hours. So more accessibility, and we have the ability to do that, and there's so many that don't, especially when you're dealing with a child that has a chronic condition or a medical condition. I do have a friend whose son cannot travel, and so she has to secure care for him so that she can go. So I think the accessibility and the education are 2 of the biggest things.
Yeah, that's a great point about education, because you see all these commercials on TV for various different kind of drugs, but we can't talk. Right now, we're unable to talk about cannabis.
Or you drive up to the gas station and you see the CBD signs, and you need to explain why what you're doing in a medical dispensary is different than what you can get at the gas station, and that needs to be dispelled, because that can harm people, and so it needs to be changed.
Delegate Adams, would you address that? What would you like to see changed in the upcoming General Assembly?
Sure. Well, I will say that I am carrying the medical cannabis omnibus bill. So, certainly, I am all in on that. I would like to say a couple of things that I think are just unique to my own practice experience. So there are many ways that the medical program is constructed sort of erroneously, and they don't make a lot of sense. But I have been stunned to see how many of my patients have, over the course of the last 2 years, have received certification and basically directed to figure it out in terms of CBD, and it was just basically CBD and no instruction whatsoever. And when I get, and so, I keep, to be clear, I've never like pronounced that I'm a delegate. I go as Dr. Adams. I have a doctorate. I'm a nurse practitioner. That is what I keep them very separate. And I have been a clinician for 35 years. So part of my clinical practice is to see somebody as a holistic person, to educate them, to provide them, alternatives, to recognize that cannabis is one support, one of the wraparound supports. When I'm seeing patients who need additional tools in their toolbox, we do those tools. We take the time and I do provide recommendations. But let's be clear, we should be not looking at this from Dr. Google, right? This is, we need people who are actually invested in learning about the practice of medical cannabis and using that as a specialty entity in a way that affords patients a resource. And also, I have patients who want to get off their narcotics. I have patients who, I have been able to see that there's clearly a methamphetamine problem in Virginia. I mean, I have seen some very clear voids of both access to information and access to wrong information. I can't tell you how many people don't know how to appropriately use CBD or don't even know how to look for the appropriate CBD, much less, how to then utilize medical cannabis and how to, really come at their own issues, in conjunction with their provider. And I talk about just, disclosing that to the provider and, how, you should, when we are talking about coming off of it, opioids, and many of my patients are on polypharmacy of opioids and benzos and many things. And, how you have to construct a plan for that. You can't just like, see, I hope you figure it out. You have to have somebody who gets it, that you got on these medications methodically. You need to come off of these medications methodically and have a plan and communication. Right. And so for me, I think a lot of the way the medical cannabis program was constructed left out these pieces of practicing medicine, which, we have, as a clinician who has done that for many years, I'm seeing these gaps and also these false, sort of, or lack of expectation that we should afford patients the quality of care that would be associated if you went to your endocrinologist or if you went to your, cancer provider. I mean, you would go to somebody who had expertise, and therefore you could actually speak to them with that knowledge and expertise. And I think that's very important in medical cannabis, and something that, at least on my lens, has not really been sort of part of the conversation, and why it's important, that we look at, yes, you actually do want a medical cannabis doctor or provider, or however you go. I mean, you don't want somebody just handing out something and saying, good luck. And because as a prescriber, I would never prescribe a medication that I didn't educate myself about. Now, and to be clear again, we are not prescribing. We are saying you have a condition that would potentially benefit from medical cannabis, and here's how it might potentially help you. If that's how you practice, that's how I practice. So thank you. I know that was long, but I could talk about this forever. I'm super passionate about it. And so I just wanted to talk a little bit.
No, that's fine. Tamara, would you like to address that? What would you like to see in the 2021 General Assembly?
Yeah, so I just want to say thank you to Dr. Adams for her expertise, but many of the practitioners that are in the program don't even, hold a candle to what she is able to do and what she offers her patients. My own experience just recently, because I moved, I wanted to establish, and I came from Northern Virginia, where my neurologist and my primary care physician were both on the medical cannabis list. And I wanted it that way. And there are patients out there that want that. They don't want to go to, somebody separate than their practitioners to then pay a fee, and then they don't really know their history and whatnot. But I'm not able to maintain that plan when I come down to, Virginia Beach, where it's everyone on the list in this area charges, and they don't give any education, none whatsoever. They hand you a piece of paper. One in particular wanted to, I did not pay it, but he wanted to charge me $200 on top of the visit, charging for the visit and charging my Medicare, which I think is wrong. I mean, it's one thing to say, okay, I'm providing you this recommendation if I was only going for the recommendation, but I feel like I got, he was charging me twice, and then doesn't want to talk about it. They're not willing to talk about it. That's it. His best explanation to me was, well, why, when I asked why the $200 and you're just handing me a piece of paper, he said, oh, I'm the best price in town. That was his best answer. And that, to me, when you're dealing with patients, shouldn't be the answer.
So Tamara, it sounds like to me that ultimately this needs to be covered by insurance like everything else.
Sure, but
Daily
I think
plan
that's a
or-
long way away. You know, the cost itself needs to come down. For me, I calculated it would cost me about $10,000 a year, all in, as a patient. Now, you know, not everybody can afford that.
Right.
I can barely afford that. And, you know, you've got patients right now that are getting their card in Virginia, but they're going to another state to get their medicine, or they're doing other things.
Okay.
So if Virginia wants to make money and wants to, you have to lower the cost. I think that is the number one thing that has to happen in 2021.
Okay. Farzana, would you address that question? What would you like to see happen in the 2021 General Assembly session? Farzana, you're on mute. Okay.
Sorry, I keep muting myself and forgetting.
No problem.
I think that listening to everyone here and being in it for quite a few years and now experiencing firsthand what Tamra has mentioned and Dr. Adams has and Lisa, you know, it's an expansion and continued expansion of where we are. It just needs to get better. The program has to focus on patients, and my passion comes from, serving the patients and listening to them, and they're coming from several aspects of the cost, getting through the process itself, holding hands. For example, I have had patients that came in, their spouses didn't know that they couldn't really come if they were not one of the registered agent or a caregiver. And so education is number one for me as a practitioner, and that goes for both ways, like education for our patients, continue education for our patients about this program, and listening to them and expanding the program based on the needs of the patient, because this program is really for the patients, right?
Right.
And we're just here to assist them. We're just here to make sure that this program administered safely, they have access, and that they're not struggling financially all the time. I have had patients that came here in my short time and like, wow, I'm going to have a hard time paying for this. So I want to make sure that there are options for that continues, that General Assembly takes those things in consideration, that this is not just for people who can afford $10,000 a year. This should be for patients who cannot afford $10,000 a year as well. So we need options. We need providers. I want to go talk to the providers and tell them about this program. And right now, the way that regulations are set, it kind of ties my hands how I speak to the providers and what aspect I can come and tell them that I have real patients. I have heard from patients who are saying, my specialty doctors are not wanting to do anything about it. So they had to seek out someone who's registered to give, because that's an extra cost, just like what Tamra was saying. And I need these physicians and practitioners to be on board that this is a real program. And this needs to be part of our practice every day. And we have real patients, and the safety, the education, and the access are always going to be my priorities.
Yeah, you alluded to one thing there when you said a patient, when they go to a dispensary, they can't take, their spouse or somebody or a caregiver with them. And if I'm not mistaken, before you can purchase at a dispensary, you actually have to physically visit that dispensary the first time before you're able to, have medicine delivered to you later. And so you touched on the fact that right now it's very restrictive, and in a lot of ways over restrictive unnecessarily. So yeah,
absolutely. And I just want to mention one other thing. I've been dealing with a lot of opioid the whole program and the system in Virginia and what's happening. I've been practicing with that for a long time. So I have had patients with opioid that has arrived in this last few days and said, I am so looking forward to getting off of these meds. I am so tired of it. It really hindering my lifestyle, my family. I mean, every aspect. I have so many stories that I could share, but of course we don't have time. But, you know, just keep in mind that these are real people. And every time we have them on hardcore drugs versus, you know, cannabis, which is, I think, has a great potential if it can be administered properly, and education is a number one, and access, and again, affordability, you know, without that, we can't get that to the patients that really needs it. So that's a concern.
Okay. All right, we have about 10 minutes left. I'm going to go through the chat. There's a few questions in the chat. There's one, this is to you, Farzana. They're asking about, you know, what are you giving back to the community in terms of reinvestment in minority communities and in those communities hardest hit by the war on drugs? And any recommendations that you may have for stakeholders who want to adopt a more effective model for reinvestment and addressing those hard hit communities as a result of the war on drugs?
Absolutely, we continue to fight the legislative process to bring the bring the cannabis more affordable for the patient that needs it. At the same time, as being in it and seeing what we need to do, we have some programs in place that can give some access, that are some discounts and so forth. But again, when you go back to the regulations, you look at it and you see how hard it is put together for us to do those type of things. Even we have to question it, like, are we crossing our lines? Are we making this as a stakeholder? Are these really, can we do this thing? So we need the program to open up. Let us come in and let us really work with the communities, work with people like Tamara and her group and whoever, that we can build together something for the communities that are looking. My biggest thing is, like, we have this program that's great. I have had these several conversation with Jen Michelle in the past, like, how do we get the product to the people that can afford it? That
Right.
child that has epilepsy, they're still getting it from somewhere. That product may not be clean still, and the program needs to be able to get there.
Right.
So yeah, we'll continue to work on that. We need to.
Okay, the next question, it looks like it's, I'm going to send this to Delegate Adams. They want to know about licensed clinicians. Are they pharmacists, doctors, nurses, or the certifications that practitioners have to go through, like holistic practitioners? Can you talk about that?
First, I want to say, I know Tamara's been trying to get in for a bit, so I want to mention that. And
then we'll go to Tamara right after you.
Okay, and then secondly, I'm not sure I understand the question.
Well, I guess what they're asking is, what's the requirement to become a practitioner?
Oh. Frankly, and this is where I'm sure I vary from other people. Frankly, I think that the lack of requirements a problem. So there is basically, you have to want to do it. So that's part of the process. So you have to actually, like, go and register as a provider. But I just personally feel like it was so important to me. I wanted to learn every single thing I could possibly learn. And I just feel like, as a clinician, I owe that is what I owe to my patients, is to practice with excellence. And so, I feel like the fact that, there is conversation about just anybody can throw out a certificate, I don't think that's helpful, because we don't have an infrastructure in our educational programs in medicine, nursing, or anything else to talk about medical cannabis as a reasonable and legitimate practice. So with that being said, I feel like there is, you want to have a competent provider who cares about you and cares about the product and how it might affect you. And so, the process is, frankly, there are limitations from over, large medical companies, like, I guess some of the big hospital employers and things like that, they have restrictions, but there is really no restriction on anybody being able to sign up for that. And I think we need to do better. We need to make it so that people who want to practice in this field and support patients are doing that with some kind of credentials. And then we need to start integrating medical cannabis into our educational programs so that it's more broadly understood, so that it can be universally recommended, as we become more competent. Because, this is why we've had problems with things like opioids. We didn't create an infrastructure that allowed medical providers to fully understand the consequences and the unintended consequences of prescribing. And so therefore we created a problem which now has a legislative, where we have General Assembly members who are not medical providers who have created policy that I think is ultimately bad. So, at the end of the day, we need to do this very smartly and really figure out a path towards universal education in the medical community, and in the interim demand that there is there's a competency associated with people providing certification so that our patients have the most benefit from an educated provider.
Thank you. Tamara, okay, go ahead.
Yeah, so I just wanted to go back. I love what she just said, and I support everything that she said. And I do think that we need more providers. And so you want quality providers, but you also want to attract them. I think there are a lot of practitioners that may be still fearful of it. So there needs to be a piece in there that in the education, so to attract more providers, but I wanted to go back to the some of the comments about opioids, and we are talking about equity here. And if you want to hit equity in the medical cannabis program, I think you need to stop making it right now it's a privileged program. It's for privileged people. It's for people that can afford it. It's people that can get to a practitioner, and many different barriers are there for patients that want to get into this program. But essentially what you're saying to somebody who cannot afford it or can't and faces some of these other barriers, you're essentially saying to them, oh, you can have opioids for your pain. You can have opioids. You can't have medical cannabis. Medical cannabis is, it's going to cost you more. It's going to, but I don't think that that's what Virginia wants to do. I don't think they want, I don't think the intention is to make this such a privileged program.
Okay. We have 1 minute left, and I'm going to let Lisa close us out. If you have anything you want to add, Lisa.
I think they said you could go to 12:05, but
I can go
I think,
okay, I'm sorry.
yeah. But anyway, I saw it in the comments. But Dr. Adams brought up a good point about, again, with the education, going back to the health systems and allowing that to happen, because patients get hospitalized, medical marijuana patients get hospitalized, and they need to be able to access their medications. And that's one thing that does need to be addressed. As my practitioner for my daughter, I gave her permission to speak with my daughter's neurologist, because I want the communication there, because we're on 5 other drugs, including the cannabis. And so we need to figure out how they're all going to interact and work down. I'm fortunate to be connected with people who can explain that to me. So I think bringing the education full circle from the patient, but also to the health systems, and allowing it to go into the facilities is a big thing. Another thing that I'd like to see is the protection for employees and parents, that they're not at risk if someone says, that Lisa is giving her daughter cannabis, which everyone knows, but someone could come after me and take away my guardianship of my daughter, and where are we then? But it also could be someone's job. So that, since we're making it somewhat legal in Virginia, then that protection needs to be in place for employees and families.
Okay.
Tamara's got another question
to that. Yeah, I have a comment to that. No, it is happening. The problem with parental protections. There's a gentleman I know that's in Virginia who has a medical cannabis card, but CPS does not recognize it at all. Not at all. And he's still breaking the law, apparently, in their eyes, and can't be a parent and be a medical cannabis patient. There's something wrong with that.
Well, these are some things that sounds like need to be addressed next month during the General Assembly. We have an ADA issue where, if somebody is, if they can't drive or they don't have access or means to get to a dispensary, they can't get the medicine, or if somebody's in hospice. So it sounds like we have some issues that you all have surfaced that should be addressed next month. We had a question about, can you all talk about the mental health aspects of medical cannabis, of having accessibility or access to medical cannabis? Let's start with Dr. Adams.
Yeah, I'm not really sure what the intention of that question is. Was there any more to it?
Let's see. It's way, there are a lot of questions, and I just,
okay. I mean, and you know, maybe Farzana also wants to jump in. I'm not really sure if I understand the intention. I mean, I don't want to just speak randomly.
yeah, I have to find it.
I mean, is the question, is it useful or what? I'm just trying to understand the.
I can't answer that. I can't.
I found it, Herb. It says, what do you see the role as psychologists and other medical health professionals as we advance towards legislation?
Yeah. Well, that was one of them. And there was another one specifically about mental health.
Do you see psychologists potentially assisting the recommendation?
I did see that question. Yes, I did see that one.
Well, yeah, I mean, I guess just, you know, to broadly.
I found it. I found it.
Okay, go ahead.
Can you speak on the mental health piece of this specifically, because part of the breaking, because part of breaking the stigma around cannabis is acknowledging that for many of us, chasing the high was actually always about pain relief, not just physical, but rather psychological, which our society does not understand or empathize with.
So I will say that I have many of my patients being referred from their psychiatrist or psychologist or mental health professional. You know, one of the questions I ask on my form has to do with, you know, does your clinician agree with your care? And so, or you know, getting involved in medical cannabis as part of your care regimen. And so, you know, I think that many of us feel that there are a lot of issues around mental health and cannabis that we need to have more conversations about. You know, cannabis is a useful product for many issues as it relates to the symptoms of related to mental health issues. But you know, again, that goes along with the other tools that you need to have in your toolbox to sort of navigate the issue at hand. And so, you know, we need to have more and more thorough conversations around that. Whoever, you know, when that was mentioned about the backstory of, you know, why somebody might be utilizing or self-medicating, those are legitimate, you know, things that we should be discussing. But as to whether it's useful with some, you know, with issues that relate to mental health, I believe that we've seen lots of information that demonstrates that it is. And so we just have to navigate with that individual person, because cannabis, in their experience with cannabis, is unique to them. I think we need to have coordinated efforts at ensuring that we have the right care for the right person, as should always be the case. So I know that was very global, but
no, that's perfect. That's perfect. Okay, so I want to thank you all, the panelists, for your participation and your thoughts about, you know, where we've come from and where we are and where you see us going. I want to thank Tom Foundation, Virginia Normal, and what we need to do. I would also ask everybody to go to the Virginia Normal website, because everything we're talking about and more is on the website in terms of legislation. So I would encourage you all the participants, please go to Virginia Normal. You know, any question that you might have, if it's not answered there, send an email to our Executive Director, Jim Michelle, and we'll get an answer to you. And while you're there, join. So with that, I'm gonna turn it back over to Ben. Thank you all.
Thank you, Herb, and thank you, Lisa, Farzana, Tamara, and Delegate Adams for sharing your insights and stories with us here today. I'd like to thank the Virginia Medical Cannabis Coalition for their support of this program, as well as Virginia Normal, Jushi, and Columbia Care for their collaboration. We'd invite you all to join us for our final panel of the day at 1 p.m. Eastern. That'll focus on equitable legalization, and as well to join us in our networking lounge that will run until 3 p.m. So thank you again, and we're looking forward to the future.